So I am Chizoba. I am Nigerian, and then I work in the Institute of Human Virology, Nigeria, and then I'm a public health physician. I have been for the past 7-8 years now. In the course of my studies, I've come to interact with a lot of students, and I've come to understand that it's not really about that certification. It's about what you bring to the table. Your experience counts too. Then what the master's program has done for me is that it has broadened my horizon. I no longer look at a problem as per my community problem, but as a global problem. So when it comes to solutions now, I look at what other countries have done and achieved it, and I try to mirror that in my own population or in my own locality. That is one thing I have gained. Two is that the community that we have, our discussion group and all that, it helps us share ideas. So even beyond maybe the topic of study, the friends I've made from our groups, I actually like discuss some things with them and they help me out. For me, communities vary, and there's no one formula that fits all. So if there's anything I have learned from my master's program so far, which I'm already putting up in my reflective work, is to ask why is there this problem in this community. So I don't just like see numbers now, because it's the data that makes us go into the community. So I don't just look at the data now and then maybe start saying, okay, was it not populated well or what? No, I ask, why is the data like that? Why is it that many women are choosing to use the TBA services, that's traditional birth attendants, rather than access prevention of mother-to-child transmission care services that are readily available in the hospital settings? Is it because they don't know enough? Is it because they are not, is it because they are being, how do I put it, not stigmatized in the hospital? Is it because they cannot afford to pay that hospital fee? Or is it because they are afraid, they choose anonymity? Or is it because the society or the community they are in actually prevents them from having access to those services? So I wouldn't have asked these questions if I wasn't exposed to what I am exposed to currently in my MPH platform. So these are actually, I think this is a major contributor to what I currently do. So, and then the funny thing is that in my program, people say, oh, if you go with Dr. G, you're going to spend time. But the truth is that when I leave a community or if I leave a facility, I live there with an impact, because I didn't just solve your problems. I taught you how to solve them yourselves. I taught you how to dig deeper and how to engage the communities you're serving more so that you get the best out of them. So that is what I got from the MPH program so far.